Welcome back on the Medical Watch. One positive effect of the pandemic has been very few cases of the flu.
In fact, Advocate Aurora Health says at their 26 hospitals in Illinois and Wisconsin, they have seen precisely 0 cases of the flu since September. Joining us now to talk about it is Dr. Frank Belmonte, the Chief Medical Officer of Advocate Children's Hospital. Thanks for being with us.
Thank you.
So is this just we've all gotten really good at hand washing and social distancing and mask wearing, or is there more to this?
No, I think it's a combination of all the mitigation efforts put in place for coronavirus have really stemmed the transmission of other viral illnesses, including flu.
Would you be able to talk about, we've seen COVID spread so quickly, so much of it, but yet we haven't seen the flu spread as much. So why do you think that is? Why is there that disparity between the two and the types of cases that we're seeing?
There's different transmissibility for the different viruses. So, of course, the efforts that we've put in place have really stemmed not only the spread of flu, but in childhood illness, croup and bronchiolitis, which are 2 other very common viral illnesses we see at this time of the year.
But it's worth noting, Illinois still had 23,000 more deaths, excess deaths as they're known, last year than the average of the previous years. So it's not as though COVID deaths or illnesses just kind of evened out what we didn't see in flu. That's an important distinction, right?
That is true. And actually, at this time last year, we were really hurting for beds in Chicago. We had a very bad flu outbreak, but we just have not seen that same effect this year.
Do you worry about sort of what happens next year? Where do we go from here? Will the flu numbers be back to what we would consider sort of pre-COVID times or back to normal? Or is there anything more to this that we should keep track of?
Yeah, I mean, that's hard to say. We see variability in flu from year to year based on the types of strains that are circulating in our population. But I think one thing is, did we learn something from the pandemic that we could put in place to stem the spread of flu in future years? And, even if you talk about hand sanitizing and hand hygiene and all of those pieces and elements that are part of our day-to-day life now, when we're out about in our communities, if we apply those techniques, we definitely can decrease spread of influenza in future years.
Can I ask, what do you think mattered most in terms of combating the flu, a lesson that we would carry forward next year or so? Is that hand washing? Is that masking? What is that?
I mean, the verdict's still out as far as whether or not we'll continue to mask during winter seasons. I know that hospital systems are thinking about this very diligently right now as well, because we actually were able to prevent transmission of these infections among staff and employees as well, which has been great to keep people at work. But I think the hand hygiene piece is a great element. How many of us now, the minute we get into our car, put on hand sanitizer?
Mm-hmm. Right.
That was not part of our habit in years past, and I think it really has helped us to prevent the spread of these viral illnesses.
Okay, thank you so much to you for your insight, Dr. Frank Belmonte. We appreciate your time.
Thank you so much.